Studio.
A hearty good afternoon and welcome to the session about how to know more about IUI and success rate. We are glad to have Dr. Mangala Gowri among us today to help us understand the topic. She will take us through that and more in this session today. Doctor, you have the stage.
Hi all, I am Dr. Mangala Gowri, fertility consultant and IVF specialist, Apollo Fertility, RR Nagar, Bangalore. Today I'll be talking about intrauterine insemination and success rate. Intrauterine insemination or IUI in short, it is one of the most commonly performed minor fertility procedure worldwide. We do get many couples to our hospital asking for this procedure. But first of all, I would like to tell who all can undergo IUI procedure. Not all the couple can undergo IUI procedure to achieve the best success rate. That is the main topic of today's talk. So who all can undergo IUI? Those couple having sperm count, low sperm count of at least 10 million, or having moderate sperm motility issues, or those who are having ejaculatory dysfunction, or couple who are requiring donor insemination can undergo IUI. Women with mild to moderate endometriosis with proven patent tube can undergo IUI, and couple belonging to unexplained infertility category wherein despite extensive the fertility evaluation, we don't know the reason why they are having infertility. Such couple can undergo IUI provided the female partner age is less than 33 or 34 years. So what are the criteria to undergo IUI? Basically, women should be ovulating in the middle of the cycle, either in natural cycle or in ovulation induction cycles. Tube should be patent, at least one tube should be patent, and women should not be having any issues with the uterus like adenomyosis or fibroid uterus. To some extent, we should also give importance to the inner lining of the womb, that is endometrium. If it is too thin or too thick, that is the inner lining of the womb. If it is too thin or too thick, then the success rate of IUI will come down. And men having moderate problems with the semen parameters, they can undergo IUI. Men who are having severe male sperm parameter abnormalities, they don't fit for IUI treatment category. And basically what we do in IUI. So basically what we do in IUI is that from second or third day of the periods, we give the woman will be started on few tablets or the injections for follicular growth, and follicular growth monitoring will be done with 2 to 3 follicular scans. And by middle of the cycle, most of the time 1 to 2 dominant size follicles would have come up, and when they reach about 18 to 20 millimeter size, we give them HCG injection for the follicle to rupture and egg release to happen. So during usually 36 to 42 hours after HCG injection, couple will be subjected for IUI procedure, wherein her husband will be told to give sample about 1 to 1.5 hour before the procedure, and this sample will be subjected for cleaning process. Cleaning process in the sense, dead cells and the dead sperms will be removed, and the sperm motility will be enhanced. Such process sample will be drawn into a thin catheter. So this catheter will be inserted into the uterus, and slowly the process sample will be pushed into the uterus. After IUI, woman will be told to lie down on the same bed for 15 to 20 minutes, basically to make sure that there won't be backflow of the sample, and we give sufficient time for the sperm to swim up into the tubes before fertilizing the egg. So after IUI, woman will be sent home with a few medication advice, wherein we basically give them only progesterone hormones most of the time to support the pregnancy, if the pregnancy happens. And woman will be told to take either urine pregnancy test or beta HCG blood test at after 18 to 20 days after IUI procedure, to know whether she is pregnant or not. But if she resumes her menstruation within this 18 to 20 days or maximum 25 days, then she will be told to undergo one more IUI cycle. So likewise, a couple will ask how many cycle we should be trying IUI. Maximum, we say if it is properly tried, 3 to 4 cycles are sufficient to decide whether that modality of treatment work for that couple or not. So after 3 to 4 cycles, if it is properly performed after 3 to 4 cycles, we can if the still couple are not conceiving, then still we can definitely say that that modality of treatment will not work for that couple and they should be taken for IVF. So, what is the worldwide success rate for IUI? It is maximum 15 to 20% when it is done properly in a done in the right couple. So, to achieve the success rate, basically all criteria should be fulfilled. So, what are the factors which reduces IUI success rate? First and foremost is the female partner age. If it is beyond 35 years, the success rate definitely comes down because of the lower equality. And those women who are having the hormone imbalance, especially in women with severe polycystic ovarian, women with high LH, the success rate comes down. Women with moderate to severe endometriosis, basically the success rate in such women is very very low. That's why we don't advocate IUI in them, because their equality will be low and the tubes will be affected in such cases. And when we do IUI for a woman with a single tube, many times they may not conceive because the other tube might have got blocked because of the infection. And though this remaining tube, if it is not blocked, still it may not be working well. That's how the patient may not be conceiving. So such patients should be pushed for IVF. And women who are obese, basically they require higher dose of injections for the follicular growth, and higher dose of medications usually compromises equality, and that's how the success rate comes down. Coming to the male factor, those who are having count less than 10 million or who are having severe motility issues, or those men who are having percentage of normally looking sperms less than or equal to 3%, or men who are more than 45 years, who usually have increased important parameter like DNA fragmentation index. So those men, they will have lower success rate with IUI when their wife undergo IUI as the fertility treatment. So last but not the least, it is smoking and alcohol, which it reduces the fertility potential and fertility treatment outcome in both men and women, whatever may be the method of fertility treatment like IUI or IVF. So overall, I would like to tell that it is very important to select the right couple for IUI treatment to have the best success rate, which is about 15 to 20%, and that's what we are seeing worldwide. Thank you.